The following video was produced prior to renaming the company Palliative Medical Calls. Revisions to change the company name within this video have been made where possible.
My name is Mary Raven. I'm a board-certified internist and hospice and palliative medicine physician. I started out my career as an internist just basically doing hospital medicine, taking care of sick patients in the inpatient setting. And over those years, I really gravitated towards the field of palliative care. And I think primarily for me, it was because I felt the need for education, not only for patients, but for families too. And what I found, oftentimes in the most difficult situations, was that if families and patients better understood what was going on and what to expect down the road, they tended to make better choices for themselves, and they were satisfied with the kind of care that they got provided. So this really led me towards palliative medicine. Palliative medicine in the institution where I worked is offered in the inpatient setting. So I started out as a hospitalist, and then over my first couple of years there started working part-time with the palliative care team and part-time with hospital medicine, and that quickly just advanced to me working full-time with palliative care because it really for me was where I felt I belonged. Palliative medicine is specialized medical care for patients with serious illness. Its focus is on the alleviation of pain, symptoms, and the stress that go along with living with chronic medical problems. The goal of palliative care really is to enhance and improve the quality of life, not only for patients, but for their families as well. It's provided by a team of people. That team includes physicians, specialized nurse practitioners, RNs. Oftentimes social workers and chaplains are involved with palliative care teams, and they work alongside your other physicians to provide an extra layer of support. Palliative care is appropriate at any age and at any stage of serious illness, and it can be provided along with other curative treatments, even like chemotherapy. It's a team approach to medical care, and it's individualized specifically for each patient. In terms of what kind of physician or provider can do palliative care, the truth is every physician should be able to provide generalist palliative care. Your primary care physician is doing it, your hospital medicine physician is doing it, your oncologist has a general skill set in palliative care. There aren't enough palliative care physicians to go around to meet the need that currently exists and what will exist in the future. But to be specially trained in palliative care, it requires a board certification. So physicians who've taken that extra step to do a fellowship, which takes about a year, or who have worked in the field of palliative care for a sufficient period of time and gained those hours, can take the test and become board certified in palliative care. The same goes for nurse practitioners and registered nurses. So those of us who have taken the time to develop a field of expertise in palliative care actually do receive a board certification for that. Palliative care is important. It's important because medicine is different now than it was 50 and 60 years ago. We've had improvements. We've had improvements in science, technology, and the advent of new medications, which has allowed us to live longer than we ever have before. 50 to 60 years ago, the first bout of pulmonary edema from heart failure oftentimes ended our lives. A bout of pneumonia, they used to call the old man's friend because it was a swift way to pass on. Well, pneumonia now is oftentimes an outpatient treatment. You get an antibiotic and you get over it and you do just fine. We're living longer, but we've also invented the chronic disease state because we've been able to extend life in all of these medical conditions. As a result, we have symptoms. We live with symptoms of those illnesses. Symptoms like shortness of breath, symptoms like pain, symptoms like fatigue, depression, anxiety and even fear of what's coming next. Palliative care grew out of that need, out of that demand for better care, for improvement in quality of life, in spite of the fact that we're living with these serious illnesses. It's actually estimated in the United States that 6 million people would benefit from palliative care. Palliative Medicine Consultants is a provider network. It's not a home health company. Home health provides a great service for the same kinds of patients, for patients for whom it's too taxing to leave their home and go back and forth to physician offices or to hospitals. But home health is nursing primarily. It's also got therapy involved. Home health can do a lot of great things like infusions of antibiotics or fluids if necessary. The difference is that palliative medicine consultants is a group of providers, nurse practitioners and physicians who can diagnose and treat disease and manage symptoms. So the two actually would augment one another. If we feel that home health is necessary, we'll pull in home health services, but the patient does not have to be on home health for palliative medicine consultants to be involved. Palliative care is oftentimes closely linked to hospice care. I want to clarify that these are different. Hospice is different from palliative care, although they are closely linked for a reason, and that's because the kind of care that's offered in hospice is truly palliative care. To palliate simply means to alleviate suffering. So hospice care does that. They provide symptom management, they provide support for family members who are taking care of patients who are in that final phase of their life. But there are restrictions to hospice care. A patient's only eligible for hospice if he is deemed to be in his final 6 months, generally, of the illness. The benefit of palliative care is that you do not have to meet that criteria. Also with hospice, patients can't be pursuing what's perceived to be curative treatments like chemotherapy and radiation. So once a decision is made for hospice, the decision truly is exclusively on comfort and not on continuing to receive life-prolonging care. Palliative care is the same type of care, but there are no restrictions. So there is no prognosis that a patient has to meet. So the patient doesn't need to be in that final 6-month phase or the terminal phase of the illness. It's opened up to a much longer period of time. And with palliative care, patients can certainly still be pursuing chemotherapy, radiation, dialysis, any kind of life-prolonging therapy. It's simply there to augment the care that is currently being done. Palliative care's special focus, as we've talked about, is on symptom management as well as improvement in illness understanding, better communication, which is something that palliative care providers are specially trained in, enhances illness understanding. If patients and families understand their condition and they understand why they're feeling certain ways and they understand what to expect for the future, they tend to have better quality of life. We can help patients feel better. Families are, we consider 50% of the equation. A lot of what we do is take care of families just as much as we take care of patients because we recognize in palliative care the importance of the family. You know, families are generally the caregivers, and this is their experience just as much as it is the patient's experience. So having an eye on that and having an understanding of that and including families in on serious conversations definitely help the overall experience for the patient and for the family. If a patient is receiving palliative care, he or she absolutely can continue seeing his primary care doctor, his oncologist, his cardiologist. Palliative medicine is really a consultative service, so it does not seek to take over the care of a patient. It's simply to help make the patient's quality of life better and even help the other physicians who are taking care of the patient by tackling some of the symptom management and the discussions about what's actually happening that help the physician become more efficient in his clinic. So they definitely are complementary of one another. By consulting palliative medicine consultants, we actually can improve the efficiency of the other treating physicians who are taking care of a patient. An oncologist, for example, has a lot of patients that they're trying to see day to day in an office. The kinds of conversations we have in palliative medicine consultants take time. They simply take time. And a lot of oncologists, although they would like to, they don't have the kind of time necessary to address goals of care and the symptoms oftentimes that patients are dealing with. So by allowing us to help participate in the care of a patient, managing those symptoms, having sincere discussions with families about what they want, perhaps what they want to avoid, we're actually able to help improve the efficiency of physicians in the clinic. Medicare, through Medicare Part B, does cover the cost of a home visit, just like it covers the cost of an outpatient clinic visit to see a primary care physician or an oncologist or a cardiologist. So certainly Medicare covers the cost of these kinds of home visits. You need to talk to your insurance provider and find out if it covers the cost of palliative care. Most of them do. Palliative Medicine Consultants is a provider network, including myself. I'm a physician, as well as other nurse practitioners who are specially trained in palliative care. What's unique about Palliative Medicine Consultants is that we actually have been able to take what is currently being done in hospital settings and bring it out into the community. We specifically are seeking out patients for whom it's a taxing effort to get to and from a doctor's office, or patients who just don't have caregivers who can get them to and from. So we go into the home and we make home visits for these kinds of patients who are dealing with chronic medical problems of any kind, whatever the diagnosis is. Especially patients who have cancer, who are getting chemotherapy. Again, that can lead to immune suppression, and so going to and from a doctor's office is probably not in their best interest. These are great patients that we could make home visits on. For cancer patients who are undergoing chemotherapy specifically, Palliative Medicine Consultants has a great chance of helping you feel better, understand your condition better, anticipate the symptoms that you may have from chemotherapy so that you can regain the strength and energy to go back and continue to receiving treatment. One of the primary reasons that patients end up having to come back and forth from home to emergency room to hospital is because of unmanaged symptoms. If palliative medicine consultants are involved, we're actually going to be able to manage those symptoms better, anticipating things that may be coming down the road, and there's a very good chance that we'll be able to help patients avoid those very burdensome emergency room stays. If you or someone that you love would benefit from the kind of care we've been describing, ask your doctor to consult palliative medicine consultants. Not all physicians are fully informed about what palliative medicine does and how it can benefit him and his patient. So it's really on the patient and the family to request this kind of care.
This video was produced prior to renaming the company Palliative Medical Calls. Revisions to change the company name within this video have been made where possible.